This presentation is on informed consent and was created by Carly DeRocha and Brianna Manley. For this presentation, we'll be discussing case number 1 that talks about a 64-year-old woman who was diagnosed with multiple sclerosis. She was hospitalized, and the physicians decided that she needed a feeding tube put in place to ensure that she gets proper nutrition. She initially consented to having the feeding tube put in place, but then later withdrew her consent. The next day, she then reconsented, but did not remember withdrawing her consent the night before. Our position is that the woman's right to autonomy should be withdrawn and the physician should intervene.
So as you could see, this is our following argument. To most people, this would seem pretty confusing. So your face may just seem like one of these other faces. But no worries, in the next few slides we will break it down piece by piece and explain it.
For informed consent to be established, a patient must be competent, understand the information, decide freely, consent to the treatment, and be given adequate information. If one of these conditions are not met, then informed consent can't be established. An autonomous person has the right to give informed consent for medical procedures. The 64-year-old woman was previously diagnosed with a disease called multiple sclerosis. Multiple sclerosis is a disease where the immune system eats away at the protective covering of the nerves and can result in many different symptoms, one of them being difficulty thinking and understanding. Without the ability to understand the information being given to her, the patient's competency becomes unclear. The woman is not fully autonomous and can't make decisions regarding her medical care on her own. Informed consent cannot be established.
The following diagram shows the effects of multiple sclerosis. As you can see the nerve damage on the protective coating taking place. A physician has a duty of beneficence to do what is right or to act in the best interest of his or her patient. Therapeutic privilege is an exemption from informed consent guidelines and is a frank exercise of paternalism. As argued by Dworkin, paternalism can be justified only as long as the patient does not have the mental ability to render decisions on their own.
Therefore, since the patient is not autonomous enough to make informed decisions, the best thing to do for the patient is to invoke therapeutic privilege. This would be supported by act-utilitarianism. An act-utilitarian would support this statement because he would determine what decision would bring about the most amount of good for the most amount of people on a case-by-case basis. For this case, an act-utilitarian would decide that the decision that would bring about the most amount of good would be to invoke the therapeutic privilege.
If one of these conditions are not met, then informed consent can't be established. The woman is not fully autonomous to render decisions on her own. Therefore, informed consent cannot be established. Since the patient is not autonomous enough to make informed decisions, the best thing for the patient is to invoke therapeutic privilege. All of these factors help us with our conclusion that since the woman cannot make informed consent and is not fully autonomous, the physician should invoke therapeutic privilege and proceed with placing the feeding tube to ensure the patient gets the proper nourishment that she needs.
Thank you for listening. I hope this case is more clear.